All right, good afternoon, everyone. We'll go ahead and get started. This is the webinar for Cancer Awareness. February is Cancer Awareness Month, and we at DRCVI, the Disability Rights Center of the Virgin Islands, wants to make sure that not only do we celebrate the survivors and the people who have come through on the other end with cancer, but also to bring awareness. We are very fortunate to have two special guests with us, one who's a practitioner and one who is a survivor. We have Ms. Thomas, who will be speaking about her journey about being a cancer survivor, and we have Dr. Hobdy, Dr. Hobdy, who will be talking about different treatments and screenings. Dr. Hobdy is actually in Tortola right now, so we're hoping her connectivity will stay good with us. I'm going to have both of them introduce themselves. In just a minute, I want to first make sure that you know who we are. We are the Disability Rights Center of the VI. We're an agency that's what's known as a protection and advocacy program. We basically help the justice for those who are in vulnerable situations. That includes anybody with a developmental disability, mental health, traumatic brain, medical, and pretty much any disability that's permanent that might need some advocacy or might need some resources. One of the things we do certainly is we do a lot of training and outreach. And we, again, want to make sure that we bring information to the community of the Virgin Islands about, particularly today, having to do with cancer. DRCVI also provides different resources, just such as information and referral. We provide short-term assistance, and we provide long-term assistance. We also provide materials and resources, and at times we can also do customized training if you have a particular group or a business you would like to learn more about disability. Without further ado, I want to go ahead and start the presentation. Dr. Hobdy, if you want to go ahead and introduce yourself, and then I'll have Jackie introduce herself.
Okay, hang on. Oh dear. So,
if connectivity is an issue, you can turn your camera off. Sometimes that helps.
okay, hold on, yeah. Huh. What's going on? Okay. Speaker, let me try again. Can you hear me?
Yes, we can.
Okay, all right, yeah, it's a little bit of an issue. Okay, so hello everyone, I'm Dr. Hobdy. I am a medical oncologist and a hematologist. I've been in private practice in the Virgin Islands for about 20 years. And I see adult patients with cancer, and we give, chemotherapy treatments and any other kind of medical, like medicines that they may need, be it tablets or IV or injections. That's what I do as a medical oncologist. So just to clarify for everyone, because I'm not sure who is in the audience, but for cancer care, you have different doctors. So I am a medical oncologist. I do the treatment with medicines, so chemotherapy, infusions, etc. Then there's a radiation oncologist, and that doctor is trained just to do radiation treatment. So radiation is given, using a machine that gives off radiation, gives off X-rays, X-ray beams. And so a radiation oncologist is usually a part of the team. And then there's a surgeon, right? So a lot of cancer patients have to undergo surgery for their cancer. So usually have a surgeon as part of the team. I just wanted to clarify that. So today I'm just going to talk a little bit about just what cancer is and, screening tests that are available, things that we should all be doing. So what is cancer? Well, cancer, it's a disease.
Dr. Hobdy, can I just 1 second? I want to, before you get to your presentation, I want to make sure Ms. Thomas has a chance to introduce herself real quick.
Okay, all right.
Good morning. My name is Jacqueline Thomas. I'm here to share my journey with breast cancer that I have fought and won since 2005. I'm just here to give my experience and to encourage men, to do early screening, and I would encourage women also to do self-breast examinations monthly. But I would let Dr. Hobby give a little more information on that. Thank you.
Okay,
Wonderful.
all right.
Thank you, Ms. Thomas. And just before we start the presentation, we will have a Q&A at the end, about 5-10 minutes. And we may be able to follow up with some resources for the doctor, for Jackie, and for DRCBI that we can help you specific to this topic. So, Dr. Hobdy, go right ahead. Thank you.
All right, thank you, Shami. So I was saying earlier that, cancer is a disease where you have abnormal cells that develop, and these abnormal cells have the ability to grow, and then they can just spread all over the body, right? From one part of the body to the next. And that then ends up in, destruction of our organs or vital organs. And so people can die from this disease. Sometimes people ask me, so what is it that causes cancer? And, there's no one thing that causes cancer, because you have all kinds of different cancers. I mean, cancer can arise from any part of the body. You can have cancer arising from your eye, from your breast, from your prostate, from your lung, from your pancreas, any organ, right? You can have cancer starting there. And the type of cancer, right, is determined by where it starts. So if the cancer starts in the breast, if they're breast cancer cells, right, they start in the breast and those cells are abnormal, then we call it breast cancer. And even if those cells spread to the brain, we don't call that brain cancer, we still call it breast cancer. We just say that the breast cancer has now spread or metastasized to the brain. We call it metastatic breast cancer. So, cancers can, there are so many triggers, right? I don't know that we know exactly when it happens or how it happens, but we do know that people have risk factors, things that will increase their risk for getting various cancers. So I'll start with breast cancer. So for example, for breast cancer, which is the most common cancer in women in the United States, there are risk factors for breast cancer. So getting older, right? As a woman gets older, she's at higher risk for getting breast cancer. Being female puts you at a higher risk. Men can get breast cancer, but far less than women. 95% of breast cancer cases occur in women and only 5% occur in men, right? Obesity, lack of activity, having a family history of breast cancer, having certain genetic mutations, right? Hereditary breast cancer. We know about, we're learning more and more about mutations like the BRCA, the BRCA gene, etc. So there are many risk factors for the various cancers. But for breast cancer, which is the most common cancer in women in the Western world, we do recommend, because it's so common, right? We have screening tools. We have tests that you can do that we recommend that you do starting at a certain age. So starting at age 40, we do recommend that a woman gets a mammogram once a year, right? And that you continue to do so as long as you're able to do so. Some of our guidelines will say, well, once a woman reaches, say, 80 or they're above 70, they age discriminate. They say, oh, they don't need a mammogram. Well, I am not a proponent of that. I believe if a person is up and about and able and they want to have an annual mammogram, that they should. And why? Because breast cancer is actually very treatable and it is curable, but you have to find it early. So we do encourage women starting at age 40 to get a mammogram. Sometimes you might need an ultrasound of the breast. So the ultrasound is the test that you do like for when a woman is pregnant and you want to look at their baby inside the uterus. So we can do an ultrasound of the breast as well. The mammogram is the gold standard. That is the first tool that we do use and we do recommend. But, younger women below, in their 40s or below may have very dense breasts. And so you might not see very well on the mammogram what's going on inside their breast. So sometimes, you know, a younger woman might need an ultrasound, and it probably is a little bit better than the mammogram. You can get a mammogram if you're under 40, especially if you have a very strong family history. Or, you know, if a woman just says, listen, I feel a lump in my breast, because we should all be examining our own breasts, by the way. So we do recommend that you do a self-breast exam, not when you're having your period, because when you're having your period, your breast gets really lumpy. So it's best to do it when you're not, when you maybe the week before or a week after, you know, when your breasts are not as lumpy, and to use your fingertips, the tips of your fingers, and go around in a circular motion from the nipple, and then you can work your way out and outward and upward and all the way around, and, you know, do it on either side, right? So you want to check both breasts. And sometimes, you know, a woman will come and say, I feel a lump in my breast, and we'll do a mammogram and we don't see anything on the mammogram. Because a mammogram is not perfect. It's probably about maybe 80 to 85% sensitive. So sometimes we'll miss some cancers on a mammogram. And then you'll do an ultrasound and you'll actually say, look, there's a lump there. And, you know, and sometimes both the mammogram and the ultrasound may not show the lump, but we do a biopsy, right? So they put a needle into the area where you feel the lump, and they take a piece and they send it to the lab to see if it is cancer. So for, you know, anybody on the line who is a woman, or if you are, even for a males, it's easier. You have small breasts, so you can actually just feel the lump. You'll see it. It's pretty obvious. And then when you go to your doctor, you know, at least once a year when you get your physical, your doctor should be doing a breast exam as well. So that's, you know, that is breast cancer, but it really is highly curable. So we have like 5 stages of breast cancer: stage 0, 1, 2, 3, and 4. And for stage 0 breast cancer, where the cells are abnormal, they're precancerous, but, you know, we still remove them surgically, the cure rate is like 95%, right? So we want people to get their mammograms and ultrasounds, you know, every year, so we can find this early, so we can really get rid of this cancer. And, you know, in terms of treating breast cancer, sometimes it's just surgery. The surgery is actually the most important thing when you find it early, before it's spread to other organs. Surgery is the most important thing. And some people may need chemotherapy. Some people may not need chemotherapy. Some people may need radiation, but they may not need radiation. Some people may need tablets, like hormone tablets sometimes, or, you know, we use for breast cancer. Some people may not need that. So part of my job is to really look at the type of breast cancer that this person has, and then I'll be able to tell them, once we do all the studies, what treatment is required. And then, you know, I work alongside with the surgeon and with the radiation doctor. We have a conversation about these things, and then we decide on the best course of treatment. So that's breast cancer in a nutshell. Another, you know, common cancer, very common actually, you know, in the Caribbean, is prostate cancer. And prostate, you know, women don't have a prostate, but men do. And the purpose of the prostate, its function is to help to make sperm, to make fluid for the sperm to be able to move along. So if a man does not have a prostate, then he cannot have children. He cannot father a child. But prostate cancer is very common. It is the most common cancer in men all over the world, but it is more common in Black men. And it is more common in men who have a family history. So if dad had prostate cancer, if a brother had prostate cancer, then that man is more likely to have prostate cancer. But again, very curable. But we have to find it early. So what is the screening test? What is the test that we recommend to look for prostate cancer to find it early? Well, we recommend a PSA blood test, right? So this is a blood test. So literally they're drawing your blood, sending it to the lab, and checking for PSA protein. It's a protein that's made by the prostate gland. So when you have cancer, you have a lot of cells growing in the prostate, the PSA level is going to be high. A normal PSA level should be 4 or less. But when you see a PSA level of 10, 15, 20, then, you know, that kind of raises a red flag, and that man needs to be evaluated further. And usually then we would refer them for a biopsy of the prostate to just, the doctor goes in, they take a little piece of the prostate and see if there are actually cancer cells growing in the prostate. Because sometimes the PSA protein can be a little bit high in men as they get older because their prostate gland actually gets larger. So it's not always cancer when the PSA is a little elevated, but it can be. And you don't know that unless, you do a biopsy of the prostate. So the current recommendations are that, starting at age 40, I guess 40 is the magic number, but that's kind of when, we start to see more prostate cancers being diagnosed. And starting at age 40, that a man should get a PSA. The guidelines are sort of all over the place. They say, some say once a year, some say, well, it depends. If you check it, then it's not that bad. Maybe you could wait a few years. I personally recommend that in our community, that a man should get it done every year. And the reason why I say that is prostate cancer affects Black men way more than any other group. So Black men are at really high risk for prostate cancer. And based on that, I don't see any downside if your insurance will cover it to getting a PSA. It's a simple blood test. Once a year, you go in for a checkup anyway. You're doing blood work anyway. So you just get it done. Ask your doctor to add it to the list of tests that they're ordering and just check it. Right. And so it's because, again, if you find it early, stage 1 prostate cancer is like 90% curable. I mean, amazing. And the treatments for prostate cancer, they vary. You can either do surgery where they remove the prostate, or they can do radiation. They have actually different types of radiation. They have an external radiation or an internal radiation, right? So you can do those things. Sometimes we incorporate hormone injections for a period of time. But again, just treatments are available. And if you do your PSA and it's picked up early, it is highly curable. So really do encourage any males on the line or any women who know you have males in your family, right? Your spouses, brothers, etc., your fathers, encourage them to get that PSA blood test done once a year, okay? And then the next cancer I'm going to talk about is colon cancer, because that's on the rise. And colon cancer, your colon is your intestine, right? It's your large intestine. And colon cancer is probably the third most common cancer in the Western world. And we think it's highly related to diet and eating a lot of animal products, a lot of meats and stuff like that, and a lot of processed foods, by the way. Those things seem to increase our risk for colon cancer, because when we look at countries or communities where people don't eat a lot of animal products, and I'm not advocating for anybody to be a strict vegetarian, but when we do look at communities where people do not eat a lot of animal products, and they certainly don't eat a lot of processed foods, they do a lot of farming, they live off the land, they tend to eat natural foods, they, fish, and they fish and get their own fish, and they don't really, get a lot of the processed foods that's in our grocery stores. Those places have very low rates of colon cancer. But when those people move from where they are, from their home country to, say, the US, then those people start to get colon cancer when they adopt a US westernized diet. I was actually reading a study recently. They were talking about Nigerians, because specifically when you go to Nigeria, you don't see a lot of colon cancer. But when Nigerians move to the US, then you start to see a lot of colon cancer in the Nigerian population. So, it's definitely related to food and to the environment. So we do have to be careful about mindful of what we're putting in our bodies. But the thing about colon cancer, is that it is preventable. It is preventable. So we don't even have to get colon cancer. If, we get a colonoscopy, right? Which is a procedure which is done by a gastroenterologist. They put a camera, well, they give you something to drink the day before to kind of clean you out, right? So you're in the bathroom all day long. You're in the bathroom all day long on the toilet, but it cleans you out. And then the following day, they put a scope, a camera in through your anus, into the rectum, and then they look at the large intestine and they're looking for polyps. Polyps are growths, right? They're abnormal cells, actually, so, and they remove the polyps. So by removing the polyps, you're actually preventing the development of colon cancer. So you can actually prevent somebody from actually developing colon cancer. You prevent it before it happens. And if somebody actually has cancer in their colon, when they do the colonoscopy, they'll see it. They will biopsy it to confirm that it is cancer. And then we'll know what to do from there to treat that patient. But the thing about it is most cancers we cannot prevent, but this is one cancer that is preventable. And unfortunately, people are getting diagnosed with colon cancer at a younger age. So we've had to move we've had to change the guidelines to move the age for screening from 50 to 45. So now we're screening people earlier. And I suspect we're probably going to lower it from 45 to 40 because we're seeing a lot of colon cancer in younger and younger patients. And again, a lot of it is based on our diet, right? Based on the foods that are available to us, because a lot of what we eat is processed. So for colon cancer, though, again, the main treatment, if it hasn't spread to other organs, is surgery. If you remove that part of the colon where the cancer is, a lot of times that can actually end up in a cure. And for stage 1 colon cancer, the surgery is it. We don't do any chemotherapy. We don't recommend anything else. We just do the surgery. And 90% of those people will never, ever have to deal with that cancer again. For stage 3 colon cancer, that's when it's gotten into the lymph nodes in the area. We do recommend 6 months of chemotherapy after the surgery. And for widespread colon cancer, stage 4, when it's all over the body, then it's not curable, usually not curable at that point in time. And we do offer various treatments, tablets, IVs, etc. So that's colon cancer. And the last cancer I want to talk about in terms of screening is cervical cancer. So only women have a cervix. It's the bottom part of your womb, of the uterus. And cervical cancer is not as common anymore on our side of the world. It is very common in Africa and other countries where they don't do a lot of screenings, where women don't get pap smears, right? Because now, we do a lot of pap smears. We have a lot of education about it. A lot of women go once a year to their gynecologist, and the gynecologist will, look inside, look at the cervix and look for any abnormal areas on the cervix. And, women are actually getting screened just more regularly and more frequently. And that has actually cut down on the incidence of cervical cancer in the Western world. So, there are countries that just don't have the resources to do pap smears. And so, unfortunately, a lot of those women, they have cervical cancer. They don't even know they have it. And when they finally realize that they have it, the cancer is, it has spread and it's far advanced. But, we do encourage women who are sexually active to get a pap smear. Talk to your gynecologist about how frequently you need to get that done. But definitely, once you're sexually active, you should consider getting a pap smear. Strongly encourage you to do that. And also, what's been great is we now have a vaccine that it's Gardasil, and it's an HPV vaccine, because HPV stands for human papilloma virus. That is the virus that causes cervical cancer. It's a sexually transmitted disease. Most of us, once we become sexually active, we have HPV, we have the virus, but not all strains of the virus will lead to cancer. There are some specific strains that will lead to cervical cancer. So when you see your gynecologist, they actually do check for the HPV virus as well to see what strain you might be carrying. But we do have a vaccine against that virus, and it is offered to young boys and girls starting around age 8 to 9 before they become sexually active, because it's most effective before a person becomes sexually active. But now they're now offering it, it's approved, and they're now offering it to people up until I think age 40 who are sexually active. So it's really good. The vaccine has made a huge difference also in the incidence of cervical cancer. So really, if, for parents, please don't shy away from it. Encourage your children to get the vaccine. So those are the 4 cancers that I just wanted to talk about screening. And just to say that, I practice in the VI Medical Foundation building in St. Thomas. It's next to the Paragon. It's in Suite 203. But if you do a Google search, look for Dr. Hobdy, you'll see the office number and you can call and make an appointment if you have cancer. If you don't have cancer, I don't need to see you. You don't need me. But hopefully, you won't have cancer and you won't need me. And I hope that whatever information I just shared with you has been helpful. And please feel free to share it with others as well. Thank you.
Thank you, Dr. Hobdy. That's incredibly helpful. We know this is sometimes a very scary conversation, and there's a lot of kind of procrastination on screening. So I'm really glad you went through the top 4, and then in terms of some good screening and treatment. So thank you so much for that. And yeah, I think Dr. Hobdy will be on for some Q&A if she's able to, and can ask more questions then. Okay. All right, Ms. Thomas, you're next. Definitely want to hear about your journey. And also as an advocate, we're advocates at DRCVI, so you're definitely an advocate as well. Welcome, Jacqueline.
Good morning. Good morning. That was a wonderful presentation by the doctor. And I guess my presence here is to say that cancer doesn't have to be a sad story. My journey basically started at age 13 when in a routine examination that it was discovered that I had a lump in my left breast. And I went through, as a child, I really didn't process any of this, but I noticed it, my parents, it was nervous, but they never really said anything to me. I went ahead and had the tumor removed, and it wasn't cancer. But I always remember the doctor said to me that, I'm trying to see what it is. Sorry. The doctor always tell me, young lady, what you're gonna have to do is from now on, you're gonna always have to check your left breast. And once a month, and that is something I did religiously for years. I've never forgotten that advice he gave me. He said it's not cancer or anything like that. I said that's something I'm gonna have to check that left breast. And sure enough, I would say 2004 is when I discovered a change. I discovered something in my left breast that I know didn't feel right. I discovered it through self-examination. And I said what I would do, I would check the other side to see if there's anything over here on the side that makes sense to me. I said, no, it does not. This doesn't feel right. I went to the family planning right here in the NCH building. And that is where I came across a practitioner that did the exam, and she was concerned also. So she sent me to the clinic at the St. Thomas Hospital where I came across Dr. Udlam. And that is where the journey started for me in dealing with this issue of breast cancer. The biopsy, I'm not going to say it wasn't a frightening situation. It was. I had the support of my church and my family. I'm sorry, let me just. Okay. I had the support of my church and my family during this process. I remember when I even went for second opinion just to make sure that the initial diagnosis was correct. I'm getting ahead of myself. Well, I went to the biopsy. where a needle was placed in the area of concern, and I had to wait for the biopsy results. So that was one of the longest times. It was December. I'll never forget. It was around Christmas time. I was waiting for these results. I said, what was happening? I got the results after New Year's, and sure enough, it was cancer. I was telling a friend that I will never forget the ringtone when that came to me, and I said, just thinking, I'm just trying to fish. Okay, this is better. I'll never forget when that call came through, and I said, for God, you have this, whatever is gonna happen. You have control of this. And it was cancer. I asked the doctor, am I gonna be okay? He said, yeah, we have this. I'll never forget it. So we planned for the surgery. I was very, I wasn't afraid of surgery. I knew the other side, God had my hand. I said, you know what, I'm gonna go through this. Whatever comes, I'm gonna go through this. At that time when I was going through this, we didn't even have the cancer center at the time. The cancer center was still being built, I remember. And I went through the surgery, and to see how God placed people in my path. I remember the lady that was next to me in the bed when I went through my surgery. That lady and I, she was in there actually to have breast reconstruction. So we both were different end of the job. I was just beginning, she was finishing up, and we were just sitting talking there, and she really encouraged me. And you know what? In fact, I'm still in contact with this lady. She was supposed to be discharged days before me, and for some reason she got a fever. And it's funny because the fever broke, and we left on the same day. I mean, she said this was something God said that she was supposed to stay there for me. I mean, that was something we still talk about even today. You know, I'm just trying to. Okay, I don't know why I came with this. Yes, it was. So much, and then the chemotherapy. Oh my goodness! I remember when I made a decision, I wasn't going to wait for my hair to fall out. I said, "Mommy, what I'm going to do? I'm gonna go to my hairdresser and I'm gonna ask him to put my hair down." And she said, "Okay." And my hairdresser told me, "You know, Jackie, your mom couldn't stay in the room when that was happening." I said, "I know." And sure enough, she took. I still keep the hairstyle even today. It's it's just so much to talk about, so much coming back, flooding back to me. But one thing about all of this that I'm saying to you, I want women to know this is beatable, okay? This could happen. You just have to be on top of what's going on with your body. Even the slightest change, you need to be on top of things. I remember we was the cancer floor at the time, but we didn't even have the cancer center at the time when I went up there. We was in a circle sitting around on the floor at St. Thomas Hospital. All kind of people, all kind of different reasons, all kind of different cancers. We were sitting down there in a circle watching TV Jakes. But the thing is about that circle, I remember everybody was there supporting each other. You know, I remember getting hooked up to my my IV and sitting next to the person that's going through some of the rough times with chemotherapy. And I said, you know what, we're gonna get through this. I remember there was a patient from St. Croix who came in, and everybody knew before she cried when you have to put the needle in her body. And by the time we were there to cheer her up, we said, we're gonna get through this. We're gonna get through this. It's something else. We lost some people along the way also in that situation, but we were there for each other. Yes, and also I have to say I went through radiation. That's when the time the cancer center was up and running at the time when we transferred down to the cancer center. I did have radiation there for around 28 days. And I remember the lady that was working the radiation for me. You said, you got a second or anything? I said, I'll leave everything in God's hands, because literally when you deal with radiation, you vomiting, you'll be showing for the kind of reaction to it. I could say I can't complain about that. I can't complain about it, except for maybe the site was itchy at the time, but they give you like certain lotions put on that area. But I just want to have the end on a positive note that even though I was going through chemotherapy, I still had to get up in the morning to take care of my kids. I still had to make sure they go to school. I had children going to Head Start at the time, and I had to something just. And I pray also. So thankful to the people that had started understood what I was dealing with. And she said, Miss Thomas, let me hold the children while you go. The guy used to have to drop them off and then go to treatment. And sometimes pick them up. Yeah. God gave me the strength to be able to still get to do the thing that a mother needs to do. Because that doesn't stop because of cancer. I'm just letting you know that this is beatable. Just need the support. And that's the reason why I'm involved in support groups right now. Because I know regular people going through this. Bills don't stop because of cancer. You still got to do the thing that you got to do when you're dealing with this. I think that's the message I want to give out. That's the message I want people to leave with. Okay. Thank you.
And thank you, Jackie. You know, everybody has a personal journey, and just the insight, the tips, the pragmaticness, you know, the day-to-day, really giving the view of going through this and coming out the other end. And I think, like you said, you can beat this. I think, Jackie, you're a testament of that. I mean, you're here with us right now as we speak. So I don't even think you have to say it. You're showing it as we speak. So, and again, we know it's going to be a very sensitive topic. It can be a very scary topic, but I think both of the guest speakers have shown us that it can be scary, but there's hope. It can be scary, but if you have faith and if you seek treatment, you know, sooner than later, there's a lot of hope and there's a lot of survival rates. So with that, I want to open it up to the audience. Please feel free to ask questions to our guest speakers. And I don't know who's maybe doing the mics, if it's Kishma or Rebecca, but if you want to unmute your mic, or if you'd like to raise your hand, if you have a question.
Yes, hi, Shami. This is Kishma. For the audience, if you have a question or a comment, you can raise your hand and your mic will be open so you can speak.
Go right ahead. So Augustus, go right ahead. Are you able to unmute yourself?
Yes, can you hear me?
Yes, we can.
Yes, concerning women's health and cervical cancer, the question would be, is HPV in adult females, let's say 25 and older, tested for as a routine women's health test? And how would you know the doctor was testing you for that?
Yeah, so nowadays, which is really good. So before they would just, when they did a pap smear, they would just actually, scrape a little part of the cervix and they were looking for cancer cells. But now they actually test for the virus. They have a test for the virus. And the gynecologist should be doing that. I mean, they don't do it every year. They have a schedule that they follow. But it's a discussion with your gynecologist. So you should ask next time you go to your gynecologist, do you do the HPV test as well as looking, doing the regular pap smear looking for cancer cells, right? So definitely discuss that with your gynecologist, because now it's recommended that they do both. Look for cancer cells and look for the virus to see what strain of the HPV virus is present in the cervix. Is that
Thank
helpful?
you. Yes,
All right.
thank you.
Okay.
Does anybody else have any other question or comment or something they'd like to share? We've got plenty of time. Okay, while we're waiting, I do want to mention one thing is there are some people who have she still had to go to work. She still had to do the day-to-day. And if you or someone you know is dealing with cancer and is still working, please let us know, particularly myself, because I do employment and disability, and there's a brochure about cancer in the workplace, and I could talk to that person about accommodations and what their rights are, and maybe vocational rehab that could help them, even if it's a temporary situation. It's an opportunity where you can get some supports if you are working and you're still dealing with this condition. So keep that in mind as well, please.
Yes, and also I just wanted to say there is an organization, it's called Cancer Support VI, and they provide mini grants, a couple $1,000s a year, but hey, that goes a long way with co-pays and for doctor's visits and scans and sometimes traveling off island. And it's available to anybody who has a new cancer diagnosis and is undergoing treatment of any kind. It's called Cancer Support VI.
Thank you, Dr. Hobdy, for bringing that up. And we had talked about maybe sending some resources after the presentation. So I will add that to it. And I believe there's some additional resources. So I'm glad you brought that up as
Yeah.
So thank you.
Somebody asked if the American Cancer Society is supportive in the VI. So they were here. They used to be here physically. They had a physical office here, but they no longer do. But they do offer some financial assistance. It's limited, but it's still, it's still available. And I think people should take advantage of it. We definitely tell our patients about it, and there are forms that you have to complete, and then we submit it to the American Cancer Society on behalf of our patients. But yes, they still do have some, activity in the territory. Maybe not as much as before, but yes, they still have a presence.
And I believe they have a toll-free number. And again, that's something that we can provide to you in the follow-up email. Because like Dr. Hobdy said, they are still marginally around as a support for sure for the territory. Any other questions? I want to take one more quick
In the Q&A,
Oh, do we
it
have a question?
says, I am just watching the webinar. I am Avril Perez, working at Lutheran Social Services at Sister Emma Cottages, and direct care worker for the disabled. Is there a question, Ms. Perez, or are you just letting us know that you're on? Right. Yeah.
Well, Ms.
I guess
Perez, if Ms. Perez does have a follow-up question, feel free to jump in again. We still have a little bit of time. Let me mention something quick that comes up quite a bit for us as we're waiting for more questions, and I will gladly stop if we have a question. Is about Social Security. And so people want to know sometimes when they have a condition like cancer, are they eligible for Social Security? And the answer typically would be yes, but everybody's situation is different. under Social Security, they do have a clause that talks about compassionate allowance. And I've known some folks who've gotten Social Security who were really in a later stage in their cancer and was able to get the Social Security due to that provision because the fact it was so dire, and it would kick in immediately opposed to months and months, if not years sometimes. So I want to mention that. And if you are someone or you know someone who is looking to apply to Social Security, give us a call. We can help them understand the process and we can get some contact information. We don't help with the appeal, but we definitely can help you go in the right direction. And like someone said recently, you've had cancer in the past, it could come up again. It's good to know about it just in case. It's better to know and not to need it than not to know and then to need it. Okay. So I'm going to ask one more round of questions. Any other questions we have? Okay, with that, again, if you
There
do
is
have
one
questions-
in the chat,
Oh,
Shami,
okay.
I'm sorry.
No.
Okay,
Are there
let's see.
opportunities? I'm sorry.
Okay.
Are there opportunities for individuals to volunteer? When my mom was diagnosed with cancer, I couldn't take her to her doctor's appointment. A volunteer was able to support her.
I do believe there are some resources for that. Was someone going to speak?
No, not me.
I heard a voice. But please jump in, anybody who has information about like volunteers who will help cancer patients with medical needs and stuff like that. Well, as I mentioned, one of the follow-ups I'll be sending in the email, it will be the resources for cancer in the Virgin Islands. Dr. Hobdy already mentioned one of them. And so Dawn, that hopefully will help to assess what those resources are, including volunteers. I can say in general that Vitran Plus and other medical transportation should be able to help with that, just as an FYI, but we know they're not always reliable or they're available, but that is another option.
Okay. Ms. Perez had a question actually. When you notice a lump on your breast, does it have any symptoms or signs besides the lump? Well, it varies. It's different for everybody. You know, most lumps, at least in the earlier stages, they're painless. You don't feel any pain. And sometimes people say, well, it can't be cancer because it's not painful. And I ought to tell you, most breast cancer lumps are not painful, right? So don't use pain as a gauge, to determine whether or not you have cancer. But if the lump is just getting bigger and bigger, and then it starts to, really stretch the skin, and then it kind of erupts and through the skin, yes, it's going to start to become painful after a while. But the bottom line here is that if you feel a lump and it wasn't there before and it's not going away, don't try and guess, right? Oh, is this cancer? It's not cancer. Please seek medical attention. Have a doctor check it out, have them send you for a mammogram and maybe an ultrasound, and then take it from there. But it's safer not to guess. It's just better to seek medical attention if you feel a lump that's not going away.
I agree 100% with that. I agree. Because when I felt it, the first thing I was saying, okay, this is probably for cyst. And I was almost going to put off my mammogram for a year or so. I said, you know what? Let me check this. Because I was feeling it, but I wasn't feeling it on the other side. It's something's wrong here.
Yeah.
And I went and I checked it out. It wasn't hard. It was movable. I said, okay. But yeah, don't try to self-diagnose. You go and have a professional look at that.
Absolutely.
I'm here to tell you.
Well said. Well said.
So true. I think that, Google becomes a doctor, and that's the most dangerous doctor I know online. So, in all seriousness, the resources are here. We talk about VI lacking some resources and medical, but there are resources here. And all of this sounds like from the practitioner point of view to the patient's point of view to the survivors, seems like preventative is your best measure. And so what I'd like to do is, we actually have our director on. I don't know if you'd like to say a couple of words before we close. Angus?
Mute. Let's go. Shami put me on the spot. I was just trying to listen in on because I had two prior meetings. My apologies. What we are trying to do with these webinars is to bring a lot of awareness and to increase people's sensitivity to the disabled community. So I'm hopeful that we had a good turnout in terms of a registration. And I want to thank the presenters for coming out. Hopefully, we'll see you not in the near distant future. And I know that there's a push to establish a cancer plan for the territory. There were a few summit meetings held. One was on St. Thomas. I'm not sure if they canceled the one on St. Croix. So I'm hoping that the public keep their ears to the ground for all those announcements when those meetings, and come out and support, because it's a disease that doesn't discriminate. So you never know. I lost one of my sisters 2 years ago, and my best friend last year. So I've had some really close calls with it, and the sooner you can arrest a diagnosis, the better off you are. If you are somebody with any kind of health issues, and what's lacking, and I'm coming at the end of all of this, in terms of the support, not just from not-for-profit like ours or references through different agencies, but we are so small, and it's such an expensive disease to control and maintain.
Yeah.
That it takes everybody in the community to address it. And so I'm happy that Dr. Hobdy, I have met Dr. Hobdy before, so I know who she is. So I'm happy that you're on there.
Yep. Oh,
And
yep. Anytime. Anytime.
thank you guys for coming up, and thanks for everybody who participated.
Thank you, Angus. And, you know, as Angus mentioned, our main point is to bring awareness. And being February is Cancer Awareness Month, you know, when we thought about the presenters, you know, these are the two best presenters. One works directly with the patients, and one is a survivor. And we couldn't have had this presentation without both of them. We have to get the awareness of somebody who's been through it as a peer, and also get the medical perspective. So we cannot thank you, both of you, enough for giving us such insights, such information, and such a human side to, you know, what some people have in the past have called the death sentence. And now we see clearly that is not the case. I personally just had a friend last month got diagnosed with prostate cancer. So that's good to hear. The rate is very high for survival. It, like Angus said, it touches people you don't know when, you don't know when, you don't know who. But be aware that there are resources, be aware there's supports, and be aware that if you're not sure where to start, at DRCBI, we can get you to all the right resources. And again, as a follow-up, we will be sending you some cancer resources, including the one I talked about, the accommodation. And if Dr. Hobdy or Jackie have any you want to add, please let me know. We'll get them out to you between today and tomorrow. We want to thank you so much for your time. Dr. Hobdy, any last questions you'd like to, I'm sorry, last statement you'd like to make?
Yeah, just early detection. Early detection is key. Don't let the fear cripple you. If you're concerned about something, go get it checked out. But also, you know what the screening tests are. So when you reach that age, right, even if you're not concerned, but we have guidelines and we have certain ages at which you need to get these tests done, just go and get them done, please.
Yeah.
Makes a difference.
Yeah, life and death almost, you know. And Ms. Thomas, few parting
Yes, I
words from
agree.
you?
Early detection. That's and just be aware of the changes going on in your body. Like I say, even with skin cancer, prostate, all of them, you have to just be aware of things that are happening in your body and go and get checked.
And there is a note in here saying, thank you, Jacqueline Thomas. You're strong and inspiring. Thank you for all the great information, Dr. Hobdy. So that's from the audience. So thank you all. I want to be mindful of people's time and just thank you again. And thanks to Dr. Hobdy's internet staying with us the whole time. And just appreciate both of your information and your insight. And we will, this is recorded. We're going to see if we can try to get in on our social media. And
I want to say also thank you, Dr. Hobdy, also. Thank you.
Thank you, Ms. Thomas, and thank you for having me, Shami. It was a pleasure.
Yes. Both of you are very busy women, I know. So thank you again. Thank you, audience. Have a very blessed day and stay safe. Take care.
Bye-bye, everybody. Have a good day.